All right, if you're a clinician, you absolutely know this feeling, just drowning in paperwork. Well, today we're going to show you how AI can take that huge mountain of documentation and, honestly, turn it into a tiny molehill. It's about getting your time back and your focus. So let's dive right in.
So let's start with a number that is just all too real for so many of us. 6 to 8 hours. Seriously, that's how much of your day can literally be eaten up by documentation. That's time that's stolen from your patients, from your family. It is a massive driver of burnout. And that's the exact problem we're going to solve today.
And just look at the scale of this change. I mean, we are not talking about shaving off a few seconds here and there. We are talking about slashing the time it takes to write a comprehensive note from, say, 20 minutes all the way down to less than 5. This isn't just some efficiency hack, you guys. It's a complete revolution for your workflow.
And the result of all this? 4 to 6 hours of your day, reclaimed. Just think about that for a second. What could you do with that time? See more patients? Finally get to that research project? Or, just go home in a normal hour. This is a total game changer.
So the big question is, how do we actually do this? Well, it all starts with one really foundational idea, the universal prompt. This thing is the engine that makes the whole process go.
At its heart, the universal SOAP note prompt is basically just a really smart template. You feed it the brief, kind of structured notes you're probably already taking, and boom, it generates a complete, professional SOAP note in just a few seconds.
And here's what it actually looks like. See how it starts by telling the AI who you are, your specialty? That's key. Then it gives you these super clear bracketed fields for all the important info, patient details, subjective findings, objective data, and so on. You're literally just filling in the blanks.
The whole workflow is designed to be just seamless. You take your notes, plug them into the prompt, and the AI does the heavy lifting of generating the note. But, and this is so important, the most critical steps are the last two, your expert review and your final submission. This tech works with you, it does not work for you.
But, that universal prompt is really just the starting line. The real power here comes from customization. You can, and you absolutely should, tailor these prompts to fit the specific needs of your specialty and your day-to-day practice.
And the beauty of this whole system is just how versatile it is. Whether you're in primary care, hospital medicine, the ER, peds, it doesn't matter what your field is, you can create prompts that are perfectly tailored to your specific clinical needs. Okay, let's take a look at an example for emergency medicine. Notice how it's structured to capture those really critical parts of an ED visit, things like pertinent negatives, which are so key for medical decision-making and risk stratification. It's that level of specific detail that makes the note it generates so incredibly useful. And it goes even further. Beyond your specialty, you can also adapt these prompts for the complexity of the visit itself. And this is absolutely essential for accurate documentation and, of course, for appropriate billing. This shows you exactly how you can match the prompt to the visit. Got a simple follow-up? Use a brief prompt. Managing a patient with a chronic condition? That needs a more detailed prompt. And for those really complex cases with multiple issues, you use a comprehensive prompt that captures all the nuance of your decision-making.
Okay, we really need to talk about what is, without a doubt, the single most important step in this entire process. While the AI is an unbelievably powerful assistant, your final clinical review is completely non-negotiable.
So here's the bottom line, and it's a big one. The AI is a tool. It assists your judgment. It never, ever replaces it. When you sign your name to that note, you are taking full professional responsibility for everything in it. The buck always, always stops with you, the clinician.
And to make sure that responsibility is met, here is your essential 3-point checklist. You have to run this on every single AI-generated note. First, the accuracy check. Are all the clinical facts right? Second, the completeness check. Does this note actually support your diagnosis? And third, the professional check. Is your clinical reasoning crystal clear?
So let's do a quick recap of what we've covered. You're going to start with that universal SOAP note prompt, but then you customize it for your specialty and for the complexity of each visit. You always, always perform that essential 3-point quality check. And by building this into your real-time workflow, you can actually get back 4 to 6 hours every single day.
So look, the technology is here. The potential to totally transform your workday is real. The only question left is the one you see right there. Are you ready to reclaim 4 hours of your day? Thanks for joining us.